Good morning, everybody. It's a little bit early to talk about these topics, and my topics in particular. This is my ordinary issue. I am a doctor and infectivologist, and I've been talking about hydrocolon therapy for many, many years. Hydrocolon therapy, also known as colon hydrotherapy or colon cleansing, has really great results, but sometimes it also had side effects, and somebody do not see this phenomenon as a very beneficial one. It is a very simple technique, but you also have to know how to do it, and you also have to explain from a psychological point of view to your patient what is going on in your body. Very often, the gut is considered as a second brain in our body, and it is definitely true. All we do, all our actions, we somatize them, and all our thoughts are actually perceived from our gut. So it is all considered as a second brain. Maybe elation or some disillusion can be psychomatized, and it has secondary effects, and it reflects itself on the gut. When your body is young and healthy and strong, everything goes on very well, and we do not ask ourselves about our health or maybe why some things or some troubles are there. But there are many problems and things going on in our body. And when we begin to understand that there is something that is not right, that something is wrong, we understand we've got some disorder. So what is colon hydrotherapy? I will allow me an aside in order to explain you. So hydrocolon therapy means water, and then colon, that is our gut. Water is the simplest and most natural element in the natural world. Water is sometimes associated with a purification process. It evokes that because it helps our body to restore its normal functioning. Very often we talk about dysbiosis. In order to explain this concept to people, I also very often try to delve into technicalities, but then also explain things very simply, put things simply in layerman terms. As I was saying, it is a technique that you have to explain to your patient. So whenever our gut has a kind of impairment or disorder, we talk about dysbiosis, which is a notion of a pathology that alters and disrupts our vital bodily functions. So as we were saying, if our body works properly, then we are healthy. So what is a dysbiosis? Well, dysbiosis is something that disrupts our normal conditions. Under normal circumstances, our gut flora is made of a great number of microorganisms coexisting in balance. But if this balance is disrupted, and so then we have some pathogens, perhaps, that disrupts our balance and create a pathology, then we talk about dysbiosis. This image here in the slide represents a little bit all of our body. So if we are healthy, everything is okay and functions properly. But starting from our airways, so the nasal cavity, up to the vaginal and genital area, when there are pathogens that strike our health, our body, then these pathogens create a situation of dysbiosis. And for every single organ that we can examine, dysbiosis manifests itself with different kind of pathologies. Then we will see that later. As all things go, also in our gut flora, we have a good part and a bad part. So as I was saying, when the good part prevails, there are no problems and everything functions properly. As an aside, all throughout the slide, I will explain you these things. I've got 100 patients. 99 of them are women, and one of them is a man. Why is this? Because women, for several reasons, and for example, for hormonal troubles or psychosomatic problems, stress, and so on, is more hit by this kind of problems than men. As you can see here in the slide, there are some pathways, we can say. Now we get an understanding of our gut microflora, what it does, and what happens if its balance is disrupted. So we have an inhibition and so an overgrowth of pathogen bacteria, and they outcompete the so-called putrefying flora. Then the fermentation of dietary fiber that elicits the immune response in our body, and vitamin synthesis, and after all this, the breakdown of compounds like protein compounds. So as I was saying, all those bacteria that create pathological conditions in our body hit the man in particular. Sorry. All you are seeing in this slide represents what happens in our body. So here we really grasp what dysbiosis is. Let's start with stress. Nowadays, everybody is stressed out, and we conduce hectic lives. We eat very badly. We do not chew on foods. We do not drink enough water, and so on. Alcohol misuse, that is very frequent among youngsters. Pharmaceuticals. Many people go to the pharmacy, to the chemists, and they just they buy pharmaceuticals without the medical advice or without their GP telling them to buy them. And pharmacists advise them, and lately there is an overuse of antibiotics in particular. Then we've got allergic reactions that are on the rise, both in children and already in childhood, and then in adult life as well. Recurrent or relapsing infections, exercise, that is working out, but there are a lot of people in a negative sense that do not exercise enough. And then a diet, which is really a very bad factor today, because many people do not eat well, and the foods that we eat today are not the same foods, not in speaking of quality, than the foods we had before. They come to our tables, but they do not have high quality. All this affects our gut. As I was saying before, allergies are on the rise, and an important factor in this is food intolerances. The majority of patients, and I'm talking about very real concrete statistics, majority of patients, as I was saying, has problems of food intolerances. But fortunately today, medical labs and clinical labs gave us the possibility to conduct some tests and take some blood samples That is a very important screening on EEG, for example, EGG and other markers that are important when we talk about diet and food. Whereas children have more allergies nowadays. We also have to say that our air quality is changed, the climate has changed, and all this really affects our body too. This pig that you can see here gives us some cues, some pigs. It may seem weird at first glance. This here is the pig of a healthy intestinal lining, of the gut lining. But when there are inflammation, pathologies, or other kind of disorders that affect our gut, our lining starts to change. It is obvious that many of us ask ourselves, why do this thing happen? So we really have to understand the root cause of these pathologies. And I always tell my patients that a good diagnosis means that I can treat that person. But if I get my diagnosis wrong, I will never have an optimal condition in order to treat that patient. This intestinal lining is very much altered, as you can see. So starting from a healthy intestinal lining, we have an inflammation process, and it becomes porous, that is to say, permeable. And from the tight junctions and the basal membrane, that is to say, the membrane that you can see in the slide, some things start to leak in the bloodstream and are allowed in the bloodstream. So, for example, these particles, these pathogens are allowed into the bloodstream, and the body gets a pathology. For example, there are bacteria or pathogens that can create a pathology. So the functioning of this part is not physiological anymore, and our body reacts very badly because it's not a natural functioning anymore. The entering of these particles into the bloodstream goes to all tissues, and when this happens, one of the organs that is hidden the most is the liver. So what does our body do? Our body becomes tired and we experience fatigue because all toxins start to be allowed in the liver, and the bloodstream that goes throughout the body affects all of organs. The first pig that I showed you, as you can recall, started from the first airways, from the nasal cavity to the final part of our abdomen, and passed in through our urinary tract. Now, there is a reason why I'm recalling this pig now. As you can see here, we've got the intestinal lining, a drawing of the intestinal epithelium or lining. You can see here the tight junctions. So when the lining is affected by some pathogens because these substances, these compounds leak through and are allowed in the bloodstream, then we have pathologies and disorders. And we are talking about a whole range of intestinal disorders, so all toxins and gluten, for example, that causes celiac disease that affects a lot of people nowadays. It's very widespread. And this causes and triggers pathologies. So these pathogens go beyond the layer and the barrier and are allowed in the bloodstream. All this starts to affect our nervous system, our immune system, our autoimmunity, our digestive system, and all the nutrients. And I tell you this, that 90% of our immune system resides and dwells in the gut. So if our bowels function properly and they are clean and healthy, then that means also that we are in good health. And it is also a prevention factor in the cancers of colon. The hydrocolon therapy is also a means of prevention because if the gut works well, then the body has an overall health. These here are the ways that in which we can see the passage from some alterations to the pathologies. We've got, for example, a disruption in the gut microflora, where we can see dysbiosis setting in. Then we've got some immune system inflammation processes in the intestinal lining. There are scars or damage in intestinal lining. There is then a loss of tolerance towards certain foods and a development of sensitivity toward those same foods. And this whole array of symptoms result in sensitivity or allergies. And this is a very important thing. This is the leaky gut syndrome. It is a vicious circle because if you see the circle, we can say that this processes follows. You can see that we start from an inflammation of the gut lining, of malabsorption, the immune response is elicited, and then all sort of intolerances set in. So it is a vicious circle that affects different organs in the body. This pic that you can see here is something very real, and they are all sorts of pathologies that I see from day in, day out in my patients. The brain, for example, our nervous system, is the first organ to be affected. Depression can set in. The patient may also experience anxiety because when a patient are not in a health state, it becomes nervous and anxious. Not because it's got some problems with anybody, but because it is a very human and normal reaction. Then we've got the skin. The skin is one of the most affected organ when we talk about gut issues. The skin reacts with acne, rosacea, eczema, and psoriasis. There are some thyroid problems as well. Lately, we've been detecting a very, very severe constipation in patients that report thyroid problems. We will talk about the colon later. Then there is the sinus and face organs inflammation. That is to say, the patient, when is affected by some pathogens, is not in a state of health. And we really have to understand the underlying causes of this. It is important. There are also some kind of rheumatoid arthritis and fibromyalgia problems. Then you can see here the adrenals in the lower part of our body and the slide. When the gut is not in a healthy state and it reacts to something bad, the first thing that the patient reports to his GP is that he has constipation, that he doesn't really drink water. But although they really eat dietary fiber and so on, then and we perform some screenings like colonoscopy, then we detect some colon enlargement, for example. What does that mean? Since all our organs in the body adapt and shape themselves to the overall health condition, then the gut as well, if it doesn't function properly, adapts itself to contain more feces, more waste matter. And to not excrete this waste matter, this fecal matter, means to intoxicate our own body. Now here we can see the consequences of a dysbiosis state. Starting from the immune system, as I was saying, we then have psychosomatic, dermatological problems. Many underestimate psychosomatic pathologies, but they are actually very important because the patient very often cannot explain this kind of troubles. And actually, the brain plays trick on the patient. There are also some metabolic alterations and metabolic imbalance. Then we've got colon disorders and some UTIs, the urinary tract infections. All that I'm telling you, and I will tell you every time I have a patient before starting a colon cleansing session, I always talk to my patient. I have a dialogue with him or her. Nowadays, we all have hectic lives. We are always in a hurry, and the GP doesn't really know his patient, but we really have to talk with our patients. The patient has to tell us, to us as doctors, what he is experiencing, what is feeling, and so on. Because I can't really treat a person if in the 3-second session that I have with him, I am always looking at my clock. I talk to my patients at least for an hour and a half every time. It is not much, but it actually is very useful. Many of my patients experience abdominal cramping and abdominal pain. So when I visit my patient, for example, I detect some abdominal pains, but also some postural troubles. Many patients tell me that the physiotherapists send them to me, and it actually has a lot to do with gut because many people experience lower back pain because they are experiencing constipation as well. When we experience abdominal spasm, then we've got also anal fissures and papulas and itching. Another thing that very often the patient experiences are urinary tract troubles, especially in women. What are the most common symptoms that our patient report to us? We have some gut alteration. 99 men and 99 women and 1 man out of my patients I was saying are constipated. Then we've got also migraines and headache. Many of my patients actually experience headache, and that is due to the gut problems they have because they do not pass stool regularly. Then we've got dermatologic troubles, which are the first ones that are healed by means of hydrocolon therapy. Many times I have patients with hives, urticaria, or dermatitis, and after just one single session of hydrocolon therapy, they are healed. They regenerate their skin. It's incredible because our body starts to react after colon hydrotherapy. Now, this slide can seem very silly here in the pic, but these white dots are Candida albicans. It is a bacteria, a yeast in particular, that naturally dwells in our gut and in our body as a whole. And as long as it comes in a yeast form and it is rootless, then everything goes well. But then pathologies can set in when it actually morphs itself in yeast with roots, with hyphas, and troubles begin that moment. For example, I have patients that have done gynecological screening and visits. The therapies and treatments for this kind of fungi and yeasts are toxic. The pharmaceuticals are toxic, and even though these treatments are done every month, not often, not always, we have actual results. Well, this is a vaginal candidosis, a vaginal candida overgrowth. Many people think that Candida is transmitted through sexual intercourse, but this is not true because we also have children, like kids, that actually have Candida overgrowth. And these little girls obviously did not have intercourse. Candida actually has a different onset, and then, of course, it can also be transmitted with sexual intercourse. But very often, the root cause of Candida albicans is not that, it's not sexual intercourse, but it is a very weakened immune system, and we are stressed out, so the infection sets in. Candida normally dwells in our gut, and it's natural that when there's an overgrowth of Candida, so a pathology with itching, which is the most evident symptom, but many women are exhausted, and many women actually experience scars and damage to their tissues due to itching, because the itching is so strong that they actually rip off their skin in trying to relieve this itching. But when there is a skin lesion, the infection actually goes on and thrives on that, so we worsen our situation. Then we've got cystitis, which is another trouble of the urinary tract. And now we get to the hydrocolon therapy.
As I was saying before, water is the most simple element that we find in nature, and it's the easiest way to cure people. Hydrocolon therapy is a therapy that is getting more and more popular every day, and sometimes you may think that it's quite strange. It's a very embarrassing therapy, but I can tell you that if the practitioner can give you more information, it means that the therapy is going to work. You have to not be fooled by people that are not in the field. I hear a lot of stories about hydrocolon therapy. Hydrocolon therapy has to be done in a very aseptic environment, a clean environment, because otherwise you come to solve a problem and you find another 100 problems later. Hydrocolon therapy is, as I was saying before, the introduction in our body of a quantity of water. Water through devices and machines, through tubes, gets into the body. I'm going to show you a hydrocolon therapy kit. Has someone ever done it before? 1, 2, 10, 12 people. This is a hydrocolon therapy kit, sterilized one. It's very important what I'm saying, because fecal bacteria are deadly. The tube is sterilized. It's even in another pocket because it has to be completely clean. Hydrocolon therapy is the introduction of water that has to propel through the body to add bulk to and help solve the problems that we have inside our body. Obviously, the patient, the first thing he does is feces. But sometimes it doesn't mean that feces are the first thing to be propelled out. We have to understand if the patient has constipation, how many times goes to the bathroom. This is a picture of my study. There is the environment, and then there is the clinic, but then you have to have a closed bathroom because the patient has to have access to a bathroom in any moment. It's a very calm therapy. The patient has to understand the therapy because as we do it, I talk with the patient just to transmit calmness, because if you're calm, body is gonna answer properly, And as water gets inside the body, there is an add of bulk adding, and it's going to eliminate all the toxins and the wastes. Wastes are so small, they're not so easy to be seen at the naked eye, but are the ones that give strength to our body to restart, we can say. Many have gas problems, stomach ache, bloating. Some of these symptoms are linked to anxiety, stress, but many of them to diet. Out of 7 out of 10 patients are intolerant. So we go back to the idea that all these pathologies are linked after the situation after we ate something. So how do we solve this problem? How does it work? What hydrocolon does at the end, it cleans. Women want a flattened belly. Sometimes we are able to eliminate 5 kilos of feces in one session. What strikes me most of the time is that when patient comes for a session, it starts to see what it is inside his intestine, his bowels. As I always say, the intestine is a mystery. So when you clean it, you understand that you have to chew. You just fall. I say to women, you just swallow. You don't chew. Sometimes you have liver or stomach problems. Or, for example, you have problems because your digestion has to start not from the bowels, but from the mouth itself. So when you don't chew, that's where the problems begin. Women, I am telling you that you have to drink a lot, 1 liter of water, you have to eat a lot of fruits, you have to chew foods in different way, especially you women, because you have this strength, this ability to do thousands and thousands of films all together. You have too many responsibilities sometimes, and these responsibilities are going to make you pay a high price. Those who do not have problems, I give you some advices. I advise you to do a colon cleansing therapy in autumn and spring, because it means that you can make your body survive during the year. I always tell you about the colon cancer. Colon cancer is nowadays a very silent cancer. When you discover it, it's too late, and sometimes the patient is already a tumor. So we talk about prevention, because hydrocolon is prevention itself. You have to feel better in order to live better. These are some important aspects that I want to present you. Constipation, diarrhea, colon dysbiosis, irritable bowel syndrome, diverticulosis. This is something I want to talk about more, because these are a little pouches that are inside our colon. Mostly men are involved, but it's not so common that men don't go to the bathroom, we can say. It's very strange. Those who have diverticulosis go to the bathroom every day, but they have to be careful for what they eat, because if some resident elements are inside the feces, they create an irritation and inflammation, and sometimes they have to use drugs, because pain is intolerable. Sometimes when I meet patients with these symptoms, I do a hydrocolon cleansing, and they don't have to use drugs anymore, because colon is going to be flattening again. So these pouches that are some hollows, we can say, they even can risk a colon perforation, because what happens is that they're going to relieve the pain, and the patient has not to take drugs anymore. And other than using medicaments, they have to use probiotics because sometimes we eliminate things, but we also bring good things inside. There are patients that they think that if they use probiotics, it's just a money problem because they have to go to the pharmacy and buy it. But in reality, lately, we also introduced the aloe juice because it gives they relieve pain if there is this kind of situations. Most of people can do hydrocolon cleansing, but sometimes there are patients that cannot undergo colon cleansing, especially those who had gastric hemorrhagia. So also when you're pregnant, sometimes I receive phone calls, I'm pregnant, can I do a colon cleansing sense? No, you can't. But sometimes also patients read on the internet and they think that everything can be solved with colon cleansing, but later on they go to the doctor and they say, no, it's not possible. Problems linked to the heart. Everybody can do hydrocolon cleansing. Men are not so easily to be convinced to do colon cleansing, but those that are in pain, they don't think about the method, they just do it because they know that they can feel better after. I do 3-5 hydrocolons every day and maybe even 10 a day. We have 8,000 patients, and they're getting more and more patients because more want to do this colon cleansing therapy because we make them feel better. But you have to know how to do it. Sometimes I have patients that tell me it's a very stupid thing. So colon cleansing is a very serious matter, and when I introduce water, I create pressure in the bowels. So the best way to have the best results is to talk with a practitioner, a real practitioner. This is our body, our colon, water. So women, pay attention. When you talk about wrinkles, drink water because it's very important. Thank you so much.
Che come vedete è una persona estremamente esperta.
He's a very incredible person. Hydrocolon therapy is a very important thing, and many people actually underestimate it, but we really have to retrieve this thing. Obviously, consulting very qualified practitioners. A hug to Dr. Lagana.